We would all like to assume, or we think we're standing up for the vulnerable, and it's a very desirable goal. However, in practice, it is often not the case. And one of the reasons this is not the case is because it's not put on top of the agenda. And the question remains, how do we get this on the top of the agenda? How do we ensure that everybody works together? So, in order to stand up for the vulnerable, we're going to have to tackle some of the issues that require long term strategies. And it requires intersectoral collaboration, it requires governance, it requires people to really put this on the top of the agenda. And in order to do this, we have to really look at what strategies work and how they work at the local level, at the national level, at the European level, and at the global level. Health for all is not just a European issue, but it is really a global issue. In Europe, we have had many, many decades of working together for health for all. So, in that way, we have a lot of experience. And I've been working closely with the European Association for Public Health, where we have researchers, practitioners, policy makers, and we come together and we try to look at health from various angles and viewpoints and try to then develop not only policy, but look at practices that will bring about change. So while in Europe, we are quite used to this and it has become very much part and parcel of our demographics, this is not the case in a lot of countries, in particular the global south. And in the global south, some of the reasons are because resources are so limited to work within the country that working across countries becomes even more challenging. And that's why the European Association for Public Health Migration and Ethnic Minority section decided to work together with colleagues on the issues related to migration, ethnicity, race, and health across the globe. We need to find solutions that not only fit in one setting, but can be used in other settings. And in order to do this, we need to learn from one another, we need to share experiences, and we need to have a continued dialogue.
It's become very clear in research the last couple of years that there's huge disparities when it comes to health based on sexual and gender minority status. LGBTQ individuals report higher risk for health and in particular mental health. So this called for more research into the determinants of these health disparities, but also to try to work to reduce these differences. And it's apparent today that the risk factors seem to exist at different levels in society, both at the structural, interpersonal, and at an individual level. So we need to work at all these levels to try to improve the life chances and health of this vulnerable group. The health of LGBTQ individuals has really been ignored for a long time. It's not until recently that we've seen improvements in population attitudes and in legislations in countries providing a more equal opportunity for health. Still today, in many countries, the situation is becoming worse, both when it comes to population attitudes and stigmatizing legislation. So we really need to have a global perspective on these questions, trying to provide or promote a less stigmatizing environment across countries to provide the equal opportunities to health and well-being for all groups.